Radio MD.
RadioMD.com.
Health made easy. This is Melanie Cole's Health Radio.
You know, we talk so much about the way we're managing our healthcare and health advocacy and all these wearable devices, but a lot of our seniors don't really know how some of this stuff works and whether they have access to some of the online tools that we're using to help keep track of our good health. And my guest today is Josh Trent. He was awarded Top 50 Digital Health Influencers in 2015 by Analytica, and he is a digital health coach with over 10 years in the health, fitness, and wellness industry. So, Josh, let's talk about our seniors. First of all, what is meant by the term digital health?
Well, digital health is really the combination of the digital and the genomic revolutions or technology with healthcare, with how we live our lives. So it's all these technology pieces, applications, devices we wear on our body that can help us show up more powerfully in our lives and in our health.
So now our poor little seniors, and my dad is 92, Josh, and I mean, he works full time, so he doesn't exercise a lot. He just goes to work and everything. But if I put a Fitbit on him or tried to get him to sit at his computer for things, it's just not happening so much for our seniors and people over 75 or so. How do we get them involved in helping to track their health?
Well, this is a phenomenal question because this is an issue of health literacy. So we really get to, as a country, focus on educating seniors how this technology can empower them and help them, take the load off their family members. There is caregiving for seniors that's approaching $5.5 billion per year, $522 billion per year. These families need and want help for taking care of seniors. Technology gives that. So how we do this, we implement policies at a governmental level, but it starts with modeling health in our own lives. If you're taking care of a parent and you're using the device yourself and it's making an impact for you in your life, well, mom and dad probably are going to be more motivated to use that same technology. So it starts with us, how we show up, but also there's some governmental policies that need to be shifted for educating seniors and improving this health literacy.
So tell us how to get started with that. I mean, we want to be good role models and we want to get our parents involved in all of this, take some of the burden off the middle population, which is me, older parents, younger kids. So how do we get started?
I get it. I mean, my mom is 67 years old and I'm 35. I have taken care of her in some ways. I think the best way to start is literally just get some information over to them. Let them know, hey, wear a simple device. Misfit is a company that makes a device called Flash. This is a really senior-friendly wearable. So it syncs with a smartphone. I would recommend getting a smartphone that has the larger buttons. Seniors don't like to push tiny buttons. So this allows the senior to be tracked on their phone. They can also share that data with a friend or family member. That gives them a starting point. We need to get a easy-to-use, seamless device on the senior's wrist so that they can get comfortable knowing that this device is actually helping them. That's really how we begin.
Okay, so that's true. Now, they've also got thin skin. They've got things they don't like to wear, something like that. So they want to see how it's helping them. How do we get them to actually wear these things?
So it's really modeling that. It's showing other case studies. There's a lot of information on my website about this for senior health, what's driving senior health. There's 5 companies that are doing a great job. One of them is by Care Predict. It's a device called Tempo. So this is a system that monitors the movement of the senior at home, and it tracks which room that the senior is in, their lifestyle. So now we can see, hey, is mom getting enough fruits and vegetables? Is she opening the fridge door enough? It lets the family member know wherever they are through that closed, safe application how mom and dad are actually doing at home. So it's a way to monitor these loved ones without having to go to the home, 3 times a day. So that's a way that technology is really helping. As far as the senior wearing a device on their wrist, I think a very simplistic device can empower the senior to know, hey, I took 5,000 steps today. That's a win. I get to celebrate how I'm being more active as I'm actively aging. Active aging technology is really what's going to move the needle for most seniors as we move forward in digital health, really.
It's true. It definitely is. And let's talk about a few more apps and some devices. Now, I know my dad has one of these life alert things that says, Jerry Cole is on the move. Jerry Cole is out walking. Jerry Cole is at work. And it is pretty cool because then we get to see exactly what he's doing without calling him up 50,000 times and being like, hey, Dad, what are you doing? So I do love that. But give us a few that you think are really great.
So I think the one we talked about where we can monitor the senior is great, but really what we're looking at is something where seniors can compete against each other. Because let's face it, I mean, no matter how old you are, you're still a child inside. You still want to have enjoyment and fun in life. So with a device like a Fitbit, which is very easy to use, also with that device I had mentioned, like the Flash by Misfit, these are very senior-friendly wearables. There's a lot of wearables out there that are made for kind of the techie, savvy people. I don't recommend those. I think the two top wearables for seniors are going to be the Flash by Misfit and the Fitbit Surge or the Fitbit Charge. It's just a nice-looking watch that you wear on your wrist. You can actually use it to track heart rate as well. And it gives the senior a large display so that they can see not only what their steps are, but they can just swipe their finger and they can see how many calories they've burned for the day. They can swipe their finger again. They can see how much activity they've had for the total day. So we're giving the senior something they can wear on their wrist that's going to encourage and empower them to take more steps and more action and then compete with their friends. You know, imagine having a group on a phone where it's 10 people that have been lifelong friends and they all get to have step competitions, meet each other at the beach, and just engage more and squeeze some of this juice out of life using the wearable, which becomes this mirror for that activity.
Absolutely. I completely agree with you. And what do you see as the future, Josh, of what we can, what do you think is going to come more and more? Because now, there's even apps and devices for blood pressure monitoring, which is great for our seniors, except for that they're being found more and more to be inaccurate. And blood pressure is a very important thing to be able to monitor and to be able to keep track of. So steps are good and movement is good, but some of our seniors need a little medical looking after. And so what do you see in the future as coming out as being really great to help them with some of the ailments they might have?
Well, I'll tell you, I'm really biased. I work with people that are looking for body composition change, but the platform I use was developed for the clinical setting. So people that want to be able to have all their devices dump into one dashboard. And that system is called Nudge Coach. Nudge Coach is created for messaging clients through a HIPAA compliant, that's through the Health and Human Services, that's a regulated process where the data is safe. And that way, coaches at any facility, any medical practitioner's office, or any health coach will be able to message safely these clients and patients and seniors, letting them know, hey, Janet, you're out of range for blood pressure in a couple days. Why don't you try doing action steps A, B, and C? It's not medical advice. It's just nudging people to make the right decisions at the right time. Now, this can also be scaled for doctors. If physicians want to use a platform like Nudge Coach or any platform that allows this wearable data to be read, that's where we're really going to see the needle turn in proactive senior health. Imagine if we can cut doctor visits by 25%, how much that can open up the healthcare space for other people and make the seniors feel more empowered because they're not taking trips to the doctor's office every week.
Well, I agree. And I've also even heard of some MedMinders, that are ones that are going to help them to maintain their adherence. So, Josh, in just the last minute here, wrap it up for us in this digital health age and especially for seniors.
I think what we're going to see is we're going to see wearables increase. We're going to see seniors be more empowered through digital health, working with a human being. Technology is great. Technology is powerful. But without the human connection and the human intention of care behind the device doesn't matter. So yes, the technology is powerful, but the human connection behind it is more powerful in my opinion. I also think we're going to see ingestibles happen where people will know there'll be a sensor in their home, and when the senior takes their medication on time, it'll signal that they've actually eaten the ingestible, so something that's really safe for them to digest. That's actually already out right now. There's a lot of information on my website too, so people can feel free to check that out at wellnessforce.com.
Wellnessforce.com. Great, great, great information. That is excellent and certainly what our seniors need, getting them involved in this digital health advocacy age. And so if you've got parents, loved ones, you can help them get involved in this digital age because it's pretty exciting and kind of fun for them too. This is Melanie Cole. You're listening to Radio MD. If you missed any of the great information, you can listen anytime, on demand or on the go at radiomd.com. Stay well.